most women not know it, but most medical professionals don't either. It is not at all uncommon for a woman experiencing a heart attack to go to an emergency room complaining of symptoms that are very, very different from those of a man, but to be misdiagnosed as having something much less severe than a man. Happens all the time. The doctor says, well, she didn't come out and say she's having chest pain because she's not having chest pain. She's having what feels like indigestion. She has neck, jaw, back pain. She has pressure, tightness, squeezing. She doesn't have chest pain. She doesn't have anything that she would associate with her heart, and she doesn't have any, quote, pain. She has everything else, but not that. And she gets misdiagnosed as having something much less severe than a heart attack. And this ends up resulting in fewer definitive studies to document a heart attack. A doctor in an emergency room who doesn't think you're having a heart attack is not going to order heart attack test procedures to prove that you're not having a heart attack. They're going to order what they think is appropriate for what you do have. So if they think you have indigestion, they're going to do whatever it takes to assess indigestion, not a heart attack. That is the big problem. Okay, but ultimately this results in fewer definitive studies to document that you had a heart attack. It results in less use of lipid-lowering medication. It results in less aggressive treatment. It results in less surgeries to fix blocked arteries. And unfortunately, many medical professionals rationalize why they don't treat women as they should or as aggressively. And they say, well, the clinical research utilized to develop guidelines for heart attack prevention don't present any special guidelines for women, and they don't. The guidelines are all designed as a one-size-fits-all based on a 165-pound man. All the research is based on a 165-pound man. And this view is as inadequate gender-specific proof of benefit. They see it as, well, if the research isn't there, if they haven't studied women, they feel like they don't know what to do with them. Other doctors apply preventive measures, but they apply what's appropriate for men, not women. With women, you have to gear and tailor all your treatment plans to her reality, to her lifestyle. Women are juggling a lot more than men. Have you ever heard a man say he's worried about trying to make both work and family life possible? Do you ever hear men talk about juggling work and family? They don't talk about that. They don't worry about it. They just go to work. Women juggle things, and women have more that you have to consider when you're developing treatment plans for them. Now, all of these oversights culminate in a higher mortality rate for women after they have a heart attack. They don't recover as well. And if we're not going to do research on women, and women don't know they're having a heart attack, and doctors don't know they're having a heart attack, and women don't get treated or evaluated for a heart attack, and they go home and die from a heart attack, you see how it all adds up? One of the reasons I make all of these podcasts and videos and write books and all for you is that there are so many problems with medical care for women. And my goal is to educate you so that you can recognize the things that are risks for you. I always say that no one will ever take care of you as well as you can take care of yourself. Your job is to get the education so that you can look out for yourself. It's not a do-it-yourself manual, but it's awareness. And the problem is, awareness is more than just saying, oh yeah, I'm aware. It's about learning the details. And that's why I'm so detailed about how I teach and how I make sure you know everything. If you suspect that you are having a heart attack, or even if you're in doubt, even if you have indigestion or some strange sensation and you just think it's unusual and it's new for you, call 911. Don't get a taxi. Don't get Uber. Don't ask your son or daughter or husband to drive you to the hospital. Call 911. Go to an emergency room. And regardless of what they say, you make them prove to you that you're not having a heart attack. Make them prove it. There are multiple tests for evaluating your heart status. There are blood tests. There's electrocardiograms where you get a heart tracing of your electrical activity. There's echocardiograms. There's angiograms where they put dye into your vessels to see which ones are open and which ones are blocked. There's a bunch of testing. Do not let them send you away with a label like indigestion or anxiety, because you can't prove those. You make them prove that you're not having a heart attack. So I've taught you that there's an incredible difference in the symptoms of heart attack in men versus women. So if you experience any of the symptoms in the long list of symptoms for women, be sure you get a complete evaluation that completely rules out a heart attack. The bottom line is that most people, including medical professionals, are still not aware of the symptoms of heart attack in women. And this is largely because of the research on heart attacks that has been done only on men. And to compensate for that, you have to know the symptoms. And you have to demand a full evaluation to rule out heart attack if you suspect that you're having one, or think you're going to have one, or just aren't sure and just feel like something is off. This disparity between the genders affects every aspect of heart attacks in females to their detriment. Now, as a result of heart attack research primarily on men, women do not receive the same level of care as men with regard to recognition of symptoms, prevention, screening, diagnostic tests, lipid-lowering medications, surgery, or rehabilitation. And as a result of heart attack research primarily on men, women have a much higher fatality rate from heart attacks than men do. And so this podcast will help you compensate for some of those flaws and hopefully save your life. Now, I will stop here with this discussion, but I want you to be sure you are listening to these podcasts in order, or go to my YouTube channel, which is Menopause Taylor. Watch the videos in order. And if you ever need me to do anything to tailor everything to you, schedule a consultation. I do one-on-one consultations with women all over the world by video conferencing. It's so easy. You go to menopausetaylor.me, you schedule a consultation. I will help you with anything. I will help you manage your menopause any way you want, but I'll make sure you know what you're doing. And the problem is most women don't know what they're doing, and that's why they fail. So schedule a consultation. It is a phenomenal experience because I have you tell me everything about you. You can upload lab data, all kinds of things, and I create a document of about 50, 60 pages detailing all the information and tailoring it to you. There's nothing better than getting it all tailored to you. So I invite you to go to my website, which is menopausetaylor.me, schedule a consultation. Do not wait, and do not let yourself have a heart attack when you could have very easily avoided it. Okay, I have to stop talking now, but I will come back with the next podcast. We will continue this chapter, this unit, this huge unit on heart attacks, and believe me, by the end of this unit, you are going to know everything. I'll talk to you again later. Bye now.